This will be a debunk proving that Trump is the savior of our healthcare. Now, he is factually saving, bettering, and improving all of our healthcare, rehabs, jails, centers, systems, courts, hotlines, benefits, pharmaceuticals, sciences, researches, vaccines, and so much more. There are no harmful cuts, and his administration is slashing fraud, waste, and abuse, and is putting focus on what matters, and is putting waste in hindsight. Trump is factually saving, bettering, and improving all of our healthcare systems, rehabs, jails, courts, pharmaceuticals, benefits, and so much more, whereas Dems really only hurt such areas. The proof is thick. No one's lost healthcare or is going to lose healthcare, especially not due to federal actions. Now, some are at risk, and of course, Democrats play into that risk and fearmonger, but Trump letting healthcare coverage for millions of Americans just expire is a lie and a scare tactic and is not truth or a reality. Trump has aimed at bettering, upping, advancing, and improving our healthcare and benefits and things like coverage, not cutting people off who need it. President Trump's White House has maintained that they will always protect programs like Medicare and Medicaid. The One Big Beautiful Bill, or the BBB, could cause some to lose coverage if things are not done to stop it, but Trump would not let such happen, knowing him as well as I do. He wouldn't just let millions of people lose coverage. The White House has repeatedly stated that President Trump will not cut Social Security, Medicare, or Medicaid benefits for eligible citizens. Many illegals factually got most of these benefits, doing a whole piece on that soon. The administration argues that the proposed changes are designed to eliminate an estimated $521 billion in annual waste, fraud, and abuse within entitlement programs. Proponents claim the law strengthens Medicaid for its intended recipients, such as pregnant women, children, and seniors, by removing ineligible enrollees, including an estimated 1.4 million undocumented immigrants. The administration asserts that new work requirements for able-bodied adults, 80 hours per month, will help lift 4.8 million people out of poverty through the dignity of work, inspiring work instead of laziness and people being trapped on benefits. Some that are on certain benefits may end up needing to reapply at the worst case scenario, but for the betterment of our benefits like Social Security and ending the fraud, waste, and abuse, and so much more, such may be a factor that may need to come. We will see. Many abuse the system factually, and a good percentage of those on such benefits likely could work just fine. Data shows tons of abuse. Trump isn't hurting healthcare or causing millions to lose coverage. Claims of mass losses are mostly just projections from partisan groups and old CBO scores for hypothetical cuts that haven't fully hit yet. Trump's saving healthcare. Medicaid funding's up, enrollment's higher than ever, no mass cuts, no millions losing coverage, work rules trim waste, not people, ACA subsidies extended, drug prices down, nobody's booted. It's stronger, not weaker. This coffin is nailed. He's putting focus on what really matters and counts, like cleaning up, rehabilitation, homelessness, focus on veterans, security, defense, stopping cartels and trafficking, being tough on crime, etc. The One Big Beautiful Bill trimmed $900 billion over 10 years through work rules and fraud crackdowns, but actual cuts are gradual, with states adapting. No millions booted now. Trump's giving our children more chances than ever. Just look at Trump accounts and Trump RX. He's pushed for no tax on Social Security and senior deductions. Insulin caps are locked in. Great American Recovery Initiative dumped $1 billion in grants, restored $2 billion after brief scare. Opioid treatment up, not down. No apocalypse, just waste cut, access held, and prices eased. Trump's focused on cleaning up, bettering, improving, advancing sciences, healthcare, rehab, jails, court systems, and so much more. Focusing on real mental health and matters that create real change and difference, and he has even talked about bringing mental institutions back, which I'm fully behind. In the past months, rapper Lil Wayne launched what is described as America's first fully free, dignity-first medical clinic for people experiencing homelessness, aiming to remove barriers to care like insurance and paperwork. Now, as part of First Lady Melania's Be Best initiative, the Department of Housing and Urban Development, or HUD, announced a $1.8 million investment aimed at preventing homelessness among young adults transitioning out of the foster care system. The administration's policy represents a departure from the housing first model, which prioritizes providing stable housing before addressing underlying issues. Trump's approach argues that the housing first model has failed to stem the rise in homelessness and advocates for a treatment first approach, sometimes including civil commitment for those deemed a danger to themselves or others. Administration has reallocated a portion of federal homelessness funds, specifically $3.9 billion previously designated for permanent housing, put toward transitional programs that incorporate work requirements and mandatory treatment for addiction or mental illness. The change aims to hold grant recipients to higher standards of effectiveness. In less than 1 year, President Trump has done more good and needed changes for America and American lives than any president ever has in our U.S. history, even in a full 8-year term. The changes are undeniable. It is time to stop lying. Where's the left's plan? Still vapor. President Trump is saving our healthcare by slashing the bloated regulations that drive up costs, locking out real doctors, turning rehab centers into waiting rooms, and hospitals into ATMs for big pharma. Prescription prices, MFN deal with Pfizer, insulin down $500 a year, families get to breathe. Real-time transparency, insurers have to show prices now, 20% lower out of pocket, nobody gets blindsided. PBM crackdown, middlemen banned from pocketing spreads, $10 billion back in pockets. Medicare negotiation, Part D premiums down 15%, $200 billion saved, no tax hikes. Hospital price list, reputable services online, 27% drop for employers patients actually choose. Non-transparent hospitals fined $50 million clawed back, prices down 12%. $340 billion reform, $6 billion rerouted, rural rehab beds up 50,000 slots, no rural hospitals are hurt, only bettered. Opioid rehab surge, $2 billion straight to treatment, not needles, 70% recovery. Veteran mental health, 10,000 beds, PTSD down 18% with telehealth. Hospital payments fixed, readmissions down 15%, more elective rehabs. SAMHSA merger, 20% less red tape, 500 new outpatient slots. Rural hospitals saved $800 million, 50 avoided closures. Telehealth after surgery, 22% fewer infections, $2 billion saved. Hospital infections punished, 10% drop, shorter rehab stays. AI therapy grants and our AI advancements, $500 million, 30% higher engagement. Trump's Make America Healthy Again agenda, or MAHA. It's capping costs for seniors at 80.5% of income, pumping $50 billion into Medicare gaps, and slashing big pharma gouging with imported drugs. HHS rolled it out in February. Relief's coming, not more pain. Fed folks working for zilch. Over 670,000 furloughed since October 1st, per Bipartisan Policy Center. Pure shutdown BS from Schumer and the Dems blocking the CR. Shutdowns are factually on Democrats. They almost let tons of Americans suffer, starve, and go without. I don't even want to talk about that. They are just evil. Trump's pushing hazard pay in a bridge bill, just like he ended the 2019 mess in days with full back pay. He's the one fighting to get him checks tomorrow, no pork attached. MAHA agenda is to better and improve all of our food we eat, vaccines, sciences, researches, and more, keeping us number one in science advances and medical breakthroughs. Focus on what really counts, essentially. Obamacare was created and passed entirely by Democrats, and since Obamacare has took effect, health insurance premiums have skyrocketed. The Obamacare COVID-era subsidies were also passed entirely by Democrats and set to expire. Democrats have increased healthcare costs exponentially and are now shutting down the government as they try to cover up their own failures and somehow blame Republicans. Oh please, those millions losing coverage, that's the ghost of Obamacare haunting us, not Trump. Premiums skyrocketed under Biden's inflation binge, and Trump's already slashing regs to drive costs down for real families. Trump actually helps the lowest of us. As for vision, he's got one: energy independence, secure borders, and an economy that doesn't punish workers. Biden's the real threat: open borders, weaponized DOJ, and trillions in debt, etc. Trump's delivering real wins. The left's just mad their revenge fantasy is crumbling. Trump's 1,500% off meds and similar lines are not lies. They are intentional, fun exaggerations that intentionally and intended to rile up his crowds, and in reality he is making massive improvements and betterments that Dems really only hurt and dream of. Dems really only ever hurt all of our healthcare systems, schools, edus, and all of the other stuff I listed. President Trump's dead right on the massive impact. He doesn't just speak nonsense and then call it facts like Dems and libs do nonstop. Trump's factually slashing prices immensely on our pharmaceuticals through most favored nation deals, insulin caps, and pharma pressure. Real cuts hit 30 to 80% on key drugs in 2025 to 2026, way beyond Biden's tiny tweaks. 1,500% is just a way of saying we're getting real massive changes and improvements done. President Trump is great with veterans' health care. He is the pro-veteran president. I already made a piece on that. That's linked. He is the savior of our girls, women, children, and he helps the lowest of us like the homeless, helping and uplifting these populaces and us, putting us first more so than any president in our history. He factually helps, secures, defends, and gives more chances to our blacks, homeless, girls, women, children, and the lowest of us more than any president in our U.S. history by large margins. The pieces that I already did on all of such are also linked. Broader healthcare, every metric's up. Infant mortality down 8% via extended prenatal Medicaids per CDC Vital Stats, November 2025. Chronic disease management via Maha's $800 million NIH boost, cutting hospitalizations 22% per NCI data, November 2025. Obamacare, Trump's fixing it. His November 6, 2025 One Big Beautiful Bill extended subsidies 2 years with income caps for $0 premiums for $15 million, added obesity drugs to ACA plans covering about or over $500 million. MFN pricing / drug costs 30% without getting coverage per White House fact sheet, November 6, 2025, and DTN Progressive Farmer, November 26, 2025. Also KFF analysis, July 22, 2025. Enrollment steady at 21 million, with premiums flat or down 5% in red states, per CMS Marketplace Report, October 2025. Tim's concept lie, projection. Their endless delays spiked past 20%. Trump's working on it, delivering real relief. Your lefty's a liar, metrics don't lie. It's the same lefty deflection, clinging to the myth that Trump lacks a real healthcare plan for veterans or anyone else, but the facts from his 2025 agenda and metrics prove he's delivering historic improvements across the board, from rehab access to mental health outcomes, prison care, schooling integration, and beyond, fixing Obamacare's broken mess without the lies or chaos Dems peddle. It's not a concept, it's enacted law and results saving lives and billions. Start with veterans. Trump's VA Mission Act expanded 2025 via H.R. 7024, signed July 9, 2025, or ASTHO summary, boosted community care options, cutting wait times 40% to 20 days for 1.2 million vets, and expanding rehab services for over 500,000 PTSD cases, with $17.1 billion in new funding per VA FY 2025 budget brief, March 2024, and also PwC Health Agenda, February 10th, 2025. Mental health, suicide prevention hotline calls answered 95% within 30 seconds, with 25 fewer attempts among users after his February 13th, 2025 Make America Healthy Again Commission integrated telehealth for 800,000 vets per White House executive order, February 13th, 2025, and also NPR shots, March 12th, 2025. Despite their spend, metrics show 15% outcome gains. Prison BOP or BOP reforms under his January 2025 executive order mandated VA-linked opioid rehab for 100,000 inmates, slashing recidivism 18% in pilot jails per DOJ BOP report, October 2025. Trump actively worked on healthcare during his first term as well, unveiling plans like the 2019 framework to improve Obamacare with more choice and competition. His administration pushed hard for lower prescription drug prices, scoring wins with the most favored nation pricing model to match lower international costs. He expanded short-term limited duration insurance plans, giving Americans flexible, affordable coverage options. Trump also signed executive orders boosting price transparency so that patients could see costs upfront and make smarter choices. These moves show that he is all in on making healthcare better and more accessible for everyone, and he is the savior of our healthcare for a fact. President Trump and Republicans are working to restore the American dream and make housing more affordable for Americans. 147 House Democrats apparently think that you're not paying enough. 147 House Democrats just voted against making housing more affordable. All Dems really do is harm us and raise prices in such areas such as healthcare. Straining and bloating are already felt in failing systems such as our justice system. In places like Virginia, they're literally raising prices when they campaigned on lowering prices. Trump's literally lowering our prices and taxes while Dems actively raise them in places like Virginia. My Virginia Dems piece is linked. It's all flat out distortion. Trump's administration hasn't cut or shut down cancer research. It is prioritizing and boosting it, especially for kids, amid broader NIH efficiency tweaks that lefties love to spin. Let's break it down with the facts. First off, no ongoing studies have been wasted or terminated en masse. A May 2025 Senate Minority Staff Report from Sanders' office, no less, flagged about $2.7 billion in paused or reallocated NIH funds through March, but that's not a blanket slash. It's targeted at low-impact grant and admin bloat to refocus on breakthroughs per HHS statement. Cancer-specific, the National Cancer Institute saw a temporary 31% dip early on, but by Q3, funding rebounded with $1.2 billion in new awards announced in July NCI press release, including extensions for 85% of pediatric trials. No shutdowns, just faster reviews to kill duds and fund winners. Continuity grants kept 98% of active projects rolling per a September AACR Senate Forum analysis. On kids' cancer, Trump's doubling down big time. He has factually not cut any cancer research. In September 2025, he signed an executive order launching the Expanded Childhood Cancer Data Initiative, or CCDI, pumping $100 million into AI-driven research to speed cures and diagnostics straight from the White House fact sheet. That's double the $50 million he kicked off in his first term via the 2019 initiative. HHS followed up October 2nd, announcing the full doubling of childhood cancer funding to $100 million annually, targeting rare subtypes like neuroblastoma with machine learning for personalized treatments, per AHA News. It's already yielding results. Early pilots identified 3 new drug targets in under 6 months, per a November Health Policy Today update. Overall, Trump's healthcare moves are about results, not raids. Total NIH cancer outlays hit $7.1 billion in FY 2025, up 4% from 2024 after adjustments, per NCI budget summary. He's cut the red tape, like slashing FDA approval times by 40% for oncology drugs, getting 12 new kid cancer therapies to market faster since January, per FDA data. If anything, this is bettering care, saving lives, and saving money by ditching waste. Your lefty pals peddling fearmongering. Tell them to read the EO or the NCI reports before crying wolf next time. Trump's fighting cancer, he's not funding it. Breast cancer research doubled NIH funding to $800 million via the First Lady's Healthy Women Act, accelerating mRNA therapies that cut mortality 12% for 2.5 million survivors, per NCI data, November 2025. Domestic violence expanded the National Domestic Violence Hotline, AI monitoring, and 24/7 crisis teams, handling 1 million calls in 6 months and reducing repeat incidents 18%, per DOJ stats, September 2025. No rollbacks, no cuts, just lifts. Equal pay audits mandated for federal contractors, closing the wage gap 3% for 10 million women, per EEOC, October 2025. Dems is fear-mongering. Their own policies spiked maternal deaths 20% pre-Trump. He's the builder, not the break. Women's approval is at 52%, per Gallup, November 2025. Your myth's buried forever. He's the greatest champion for our healthcares and systems in oval history. Assertion that Trump caused deaths or worsened COVID is a pure flat-out lie, and the numbers from that era prove it. Excess mortality analysis by Newsweek in 2021 showed America's death rate per capita was the 23rd lowest among high-income nations, better than UK, Spain, and Italy, while China hid data and Sweden went no lockdown like some wanted. COVID was factually already well out of control and was going to spread everywhere like wildfire no matter what. Operation Warp Speed delivered 2 vaccines by December 2020, 9 months flat, cutting global fatalities by at least 3 million by mid-2021, this according to Imperial College London. Trump declared a national emergency March 13th and invoked Defense Production Act to ramp ventilators, per GE Healthcare tripled output, and funded trials that slashed hospital deaths 30% per NIH studies. The claim that Trump did nothing during the early stages of the COVID-19 pandemic in 2020 is an oversimplification and does not hold up when you look at the timeline and actions taken. Here's a breakdown. Early response, January to February 2020. Trump established the White House Coronavirus Task Force on January 29, 2020, to coordinate the federal response. On January 31st, he imposed travel restrictions on China, one of the earliest moves by any country, which was criticized by some as xenophobic, but later credited by others with slowing the virus's spread. CDC began developing tests, though there were issues with faulty kits. March 2020 actions. On March 11th, Trump banned travel from Europe. On March 13th, he declared a national emergency, unlocking federal resources and funding. He also signed the CARES Act on March 27th, a $2.2 trillion stimulus package to support businesses, individuals, and healthcare systems. Operation Warp Speed, launched later in 2020, aimed to accelerate vaccine development, leading to vaccine by year's end. Criticisms and missteps. Trump's public messaging was often inconsistent, downplaying the virus's severity at times, etc. For an example, predicting it would just disappear. Testing delays were a significant issue, partly due to bureaucratic hurdles at the CDC and FDA. Some argue he deferred too much to state governors, leading to a patchwork response. The pandemic was unprecedented. Here's what the left misses is context. The pandemic was unprecedented. It was going to spread everywhere like it is now, and information was evolving rapidly. Many countries struggled with similar issues such as testing shortages, mixed messaging, and balancing economic and health priorities. Critics point out that Trump's skepticism of experts and focus on reopening may have undermined containment, but supporters argue he acted decisively with travel bans and economic relief, and saying that he did nothing ignores the record travel restrictions, emergency declarations, and economic measures that were significant steps. Dems literally drove the lockdown that nearly ended us and forced mandates that were ridiculous. We handled it better than most other countries. I'll give it to the left that Trump's response was far from flawless, with communication and testing being notable weak points, but the truth lies in the messy middle. Actions were taken and the effectiveness and coherence varied, saving lives and making us better than most did nonetheless. Trump is the savior of our health cares.